Next Gen NCLEX RN practice questions and answers. Question 1. In assessing the nature of the stool of a client who has cystic fibrosis, what would the nurse expect to see? Here are the options. Option A. Clay-colored stools. Option B. Steatorrhea stools. Option C. Dark brown stools. Option D. Blood-tinged stools. The correct answer is option B. Steatorrhea stools. A clay-colored stools indicate dysfunction of the liver or biliary tract. In the early stages of cystic fibrosis, fat absorption is primarily affected, resulting in fat, foul, frothy, bulky stools. Dark brown stools indicate normal passage through the colon. Deep blood-tinged stools indicate dysfunction of the gastrointestinal GI tract. Question 2. A group of nursing students at a local preschool day care center are going to screen each child's fine and gross motor, language, and social skills. The students will use which one of the most widely used screening tests? Here are the options. Option A. Revised Prescreening Developmental Questionnaire. Option B. Goodenough Draw Person Screening Test. Option C. Denver Development Screening Test. Option D. Caldwell Home Inventory. The correct answer is option C. Denver Development Screening Test. The revised Prescreening Developmental Questionnaire is more age-appropriate and offers simplified parent scoring and easier comparison. It is used by parents instead of professionals. The Goodenough Draw Person test is used to assess intellectual development. The Denver Developmental Screening Test is one of the most widely used screening tests. It offers a concise, easy-to-administer, systematic approach to assessing the preschool child. It is widely used because of its reliability and validity. The Caldwell Home Inventory is used to assess the home environment in areas of social, emotional, and cognitive supports. Question 3. A mother came to the pediatric clinic with her 17-month-old child. The mother would like to begin toilet training. What should the nurse teach her about implementing toilet training? Here are the options. Option A. Take 2 or 3 favorite toys with the child. Option B. Have a child-sized toilet seat or training potty on hand. Option C. Explain to the child she is going to void and defecate. Option D. Show disapproval if she does not void or defecate. The correct answer is option B. Have a child-sized toilet seat or a training potty on hand. Giving her toys will distract her and interfere with toilet training because of inappropriate reinforcement. A child-sized toilet seat or training potty gives a child a feeling of security. She should use words that are age-appropriate for the child. Children should be praised for cooperative behavior and or successful evacuation. Question 4. A mother is unsure about the type of toys for her 17-month-old child. Based on knowledge of growth and development, what toy would the nurse suggest? Here are the options. Option A. A pull toy to encourage locomotion. Option B. A mobile to improve hand-eye coordination. Option C. A large toy with movable parts to improve pincer grasp. Option D. Various large colored blocks to teach visual discrimination. The correct answer is option A. A pull toy to encourage locomotion. Increased locomotive skills make push-pull toys appropriate for the energetic toddler. Infants progress from reflex activity through simple repetitive behaviors to imitative behavior. Hand-eye coordination forms the foundation of other movements. See, at age 8 months, infants begin to have pincer grasp. Toys that help infants develop the pincer grasp are recommended for this age group. D. Various large colored blocks are suggested toys for infants 612 months of age to help visual stimulation. Question 5. A 16-year-old student has a long history of bronchial asthma and has experienced several severe asthmatic attacks during the school year. The school nurse is required to administer 0.2 ml of 1/1000 solution of epinephrine SC during an asthma attack. How does the school nurse evaluate the effectiveness of this intervention? Here are the options. Option A. Increased pulse rate. Option B. Increased expectorative secretions. Option C. Decreased inspiratory difficulty. Option D. Increased respiratory rate. The correct answer is option C. Decreased inspiratory difficulty. A side effect of epinephrine is fatal ventricular fibrillation owing to its effects on cardiac stimulation. B. Medications used to treat asthma are designed to decrease bronchospasm, not to increase expectorative secretions. C. Epinephrine decreased inspiratory difficulty by stimulating 1 and 2 receptors causing sympathomimetic stimulation, for example bronchodilation. D. The person with asthma fights to inspire sufficient air, thus increasing respiratory rate. Question 6. Respiratory function is altered in a 16-year-old asthmatic. Which of the following is the cause of this alteration? Here are the options. Option A. Altered surfactant production. Option B. Paradoxical movements of the chest wall. Option C. Increased airway resistance. Option D. Continuous changes in respiratory rate and depth. The correct answer is option C. Increased airway resistance. Altered surfactant production is found in sudden infant death syndrome. B. Paradoxical breathing occurs when a negative intrathoracic pressure is transmitted to the abdomen by a weakened, poorly functioning diaphragm. C. Asthma is characterized by spasm and constriction of the airways resulting in increased resistance to airflow. D. If the pulmonary tree is obstructed for any reason, inspired air has difficulty overcoming the resistance and getting out. The rate of respiration increases in order to compensate, thus increasing air exchange. Question 7. A mother frantically calls the emergency room ER asking what to do about her 3-year-old girl who was found eating pills out of a bottle in the medicine cabinet. The ER nurse tells the mother to. Here are the options. Option A. Give the child 15 ml of syrup of ipecac. Option B. Give the child 10 ml of syrup of ipecac with a sip of water. Option C. Give the child 1 cup of water to induce vomiting. Option D. Bring the child to the ER immediately. The correct answer is option D. Bring the child to the ER immediately. Before giving any emetic, the substance ingested must be known. B. At least 8 Oz of water should be administered along with ipecac syrup to increase volume in the stomach and facilitate vomiting. C. Water alone will not induce vomiting. An emetic is necessary to facilitate vomiting. D. Vomiting should never be induced in an unconscious client because of the risk of aspiration. Question 8. A mother brings her 3-year-old child who is unconscious, but breathing to the ER with an apparent drug overdose. The mother found an empty bottle of aspirin next to her child in the bathroom. Which nursing action is the most appropriate? Here are the options. Option A. Put in a nasogastric tube and lavage the child's stomach. Option B. Monitor muscular status. Option C. Teach mother poison prevention techniques. Option D. Place child on respiratory assistance. The correct answer is option A. Put in a nasogastric tube and lavage the child's stomach. The immediate treatment for drug overdose is removal of the drug from the stomach by either forced emesis or gastric lavage. The child's unconscious state prohibits forced emesis. B. Toxic amounts of salicylates directly affect the respiratory system, which could lead to respiratory failure. C. The mother's anxiety is probably so high that preventive guidance will be ineffective. D. Respiratory assistance is not needed if the child's respiratory function is unaltered. Question 9. A parent told the public health nurse that her 6-year-old son has been taking tetracycline for a chronic skin condition. The parent asked if this could cause any problems for the child. What should the nurse explain to the parent? Here are the options. Option A. Giving tetracycline to a child younger than 8 years may cause permanent staining of his teeth. Option B. If you give tetracycline with milk, it may be absorbed readily. Option C. The medication should be given to adults, not children. Option D. Secondary infections of chronic skin disorders do not respond to antibiotics. The correct answer is option A. Giving tetracycline to a child younger than 8 years may cause permanent staining of his teeth. A tetracycline should be avoided during tooth development because it interferes with enamel formation and dental pigmentation. B. Milk interferes with the absorption of tetracyclines. C. Children older than 9 years or past the tooth development stage may be given tetracycline. D. Secondary infections of chronic skin disorders may respond to antibiotics such as penicillin or tetracyclines. Question 10. A 6-month-old infant has developmental delays. His weight falls below the 5th percentile when plotted on a growth chart. A diagnosis of failure to thrive is made. What behaviors might indicate the possibility of maternal deprivation? Here are the options. Option A. Responsive to touch, wants to be held. Option B. Uncomforted by touch, refuses bottle. Option C. Maintains eye-to-eye contact. Option D. Finicky eater, easily pacified, cuddly. The correct answer is option B. Uncomforted by touch, refuses bottle. A normal infant attachment behaviors include responding to touch and wanting to be held. B. Maternal deprivation behaviors include poor feeding, stiffening and refusal to eat, and inconsistencies in responsiveness. C. Attachment behavior includes maintaining eye contact. D. Maternal deprivation behaviors include displeasure with touch and physical contact. Question 11. A mother continues to breastfeed her 3-month-old infant. She tells the nurse that over the past 3 days she has not been producing enough milk to satisfy the infant. The nurse advises the mother to do which of the following? Here are the options. Option A. Start the child on solid food. Option B. Nurse the child more frequently during this growth spurt. Option C. Provide supplements for the child between breastfeeding so you will have enough milk. Option D. Wait 4 hours between feedings so that your breasts will fill up. The correct answer is option B. Nurse the child more frequently during this growth spurt. Solid foods introduced before 46 months of age are not compatible with the abilities of the GI tract and the nutritional needs of the infant. B. Production of milk is supply and demand. A common growth spurt occurs at 3 months of age, and more frequent nursing will increase the milk supply to satisfy the infant. C. Supplementation will decrease the infant's appetite and in turn decrease the milk supply. When the infant nurses less often or with less vigor, the amount of milk produced decreases. D. Rigid feeding schedules lead to a decreased milk supply, whereas frequent nursing signals the mother's body to produce a correspondingly increased amount of milk. Question 12. An 8-week-old infant has been diagnosed with gastroesophageal reflux. The nurse is teaching the infant's mother to care for the infant at home. Which one of the following statements by the nurse is appropriate regarding the infant's home care? Here are the options. Option A. Lay the infant flat on her left side after feeding. Option B. Feed the infant every 4 hours with half-strength formula. Option C. Antacids need to be given an hour before feeding. Option D. Play activities should be carried out before instead of after feedings. The correct answer is option D. Play activities should be carried out before instead of after feedings. Elevating the child's head to a 30-degree angle is the recommended position for gastroesophageal reflux. The supine position predisposes the child to aspiration. B. Small, frequent feedings with thickened formula are recommended to minimize vomiting. C. Antacids should be given at the same time as the feeding to improve their buffering action. D. The infant should be kept still after feedings to reduce the risk of vomiting and aspiration. Vigorous activities should be carried out before feedings. Question 13. The nurse is preparing a 6-year-old child for enrollment for insertion. Which one of the following statements by the nurse is appropriate when preparing a child for a potentially painful procedure? Here are the options. Option A. Some say this feels like a pinch or a bug bite. You tell me what it feels like. Option B. This is going to hurt a lot. Close your eyes and hold my hand. Option C. This is a terrible procedure, so don't look. Option D. This will hurt only a little. Try to be a big boy. The correct answer is option A. Some say this feels like a pinch or a bug bite. You tell me what it feels like. Educating the child about the pain may lessen anxiety. The child should be prepared for a potentially painful procedure, but avoid suggesting pain. The nurse should allow the child his own sensory perception and evaluation of the procedure. B. The nurse should avoid absolute descriptive statements and allow the child his own perception of the procedure. C. The nurse should avoid evaluative statements or descriptions and give the child control in describing his reactions. D. False statements regarding a painful procedure will cause a loss of trust between the child and the nurse. Question 14. The nurse enters the playroom and finds an 8-year-old child having a grand mal seizure. Which one of the following actions should the nurse take? Here are the options. Option A. Place a tongue blade in the child's mouth. Option B. Restrain the child so he will not injure himself. Option C. Go to the nurse's station and call the physician. Option D. Move furniture out of the way and place a blanket under his head. The correct answer is option D. Move furniture out of the way and place a blanket under his head. The nurse should not put anything in the child's mouth during a seizure. This action could obstruct the airway. B. Restraining the child's movements could cause constrictive injury. C. Staying with the child during a seizure provides protection and allows the nurse to observe the seizure activity. D. The nurse should provide safety for the child by moving objects and protecting the head. Question 15. A 6-month-old infant is receiving ribavirin for the treatment of respiratory syncytial virus. Ribavirin is administered via which one of the following routes? Here are the options. Option A. Oral. Option B. IM. Option C. Roman 4. Option D. Aerosol. The correct answer is option D. Aerosol. A ribavirin is not supplied in an oral form. B. Ribavirin is administered by aerosol in order to decrease the duration of viral shedding within the infected tissue. C. Ribavirin is not approved for Roman IV use to treat respiratory syncytial virus. D. Ribavirin is a synthetic antiviral agent supplied as a crystalline powder that is reconstituted with sterile water. A small aerosol particle generator unit aerosolizes the medication for delivery by oxygen hood, croup tent, or aerosol mask. Question 16. A 5-year-old child has suffered second-degree thermal burns over 30% of her body. 48 hours after the burn injury, the nurse must begin to monitor the child for which one of the following complications? Here are the options. Option A. Fluid volume deficit. Option B. Fluid volume excess. Option C. Decreased cardiac output. Option D. Severe hypotension. The correct answer is option B. Fluid volume excess. A fluid volume deficit resulting from fluid shifts to the interstitial spaces occurs in the first 48 hours. B. 48 hours to 72 hours after the burn injury and fluid resuscitation, capillary permeability is restored and fluid requirements decrease. Interstitial fluid returns rapidly to the vascular compartment, and the nurse must monitor the child for signs and symptoms of hypervolemia. C. Increased cardiac output results as fluids shift back to the vascular compartment. D. Hypertension is the result of hypervolemia. Question 17. Which one of the following is considered a reliable indicator for assessing the adequacy of fluid resuscitation in a 3-year-old child who suffered partial and full-thickness burns to 25% of her body? Here are the options. Option A. Urine output. Option B. Edema. Option C. Hypertension. Option D. Bulging fontanelle. The correct answer is option A. Urine output. A urinary output is a reliable indicator of renal perfusion, which in turn indicates that fluid resuscitation is adequate. Roman IV fluids are adjusted based on the urinary output of the child during fluid resuscitation. B. Edema is an indication of increased capillary permeability following a burn injury. C. Hypertension is an indicator of fluid volume excess. D. Fontanelles close by 18 months of age. Question 18. A 4-year-old child is being discharged from the hospital after being treated for severe croup. Which one of the following instructions should the nurse give to the child's mother for the home treatment of croup? Here are the options. Option A. Take him in the bathroom, turn on the hot water, and close the door. Option B. Give him a dose of antihistamine. Option C. Give large amounts of clear liquids if drooling occurs. Option D. Place him near a cool mist vaporizer and encourage crying. The correct answer is option A. Take him in the bathroom, turn on the hot water, and close the door. An initial home treatment of croup includes placing the child in an environment of high humidity to liquefy and mobilize secretions. B. Antihistamines should be avoided because they can cause thickening of secretions. C. Drooling is a characteristic sign of airway obstruction, and the child should be taken directly to the emergency room. D. Crying increases respiratory distress and hypoxia in the child with croup. The nurse should promote methods that will calm the child. Question 19. A 7-year-old child is brought to the ER at midnight by his mother after symptoms appeared abruptly. The nurse's initial assessment reveals a temperature of 104.5 F 40.3 C, difficulty swallowing, drooling, absence of a spontaneous cough, and agitation. These symptoms are indicative of which one of the following? Here are the options. Option A, acute tracheitis. Option B, acute spasmodic croup. Option C, acute epiglottis. Option D, acute laryngotracheal bronchitis. The correct answer is option C, acute epiglottis. Clinical manifestations of acute tracheitis include a 23-day history of URI, croupy cough, stridor, purulent secretions, high fever. B. Clinical manifestations of spasmodic croup include a history of URI, croupy cough, stridor, dyspnea, low-grade fever, and a slow progression. The age group most affected is 3 months to 3 years. C3 clinical observations have been found to be predictive of epiglottitis. The presence of drooling, absence of spontaneous cough, and agitation. Epiglottitis has a rapid onset that is accompanied by high fever and dysphagia. D. Clinical manifestations of acute laryngotracheal bronchitis (LTB) include slow onset with a history of URI, low-grade fever, stridor, brassy cough, and irritability. Question 20. The nurse is teaching a mother care of her child's speak cast. The mother states that he complains of itching under the edge of the cast. One non-pharmacological technique the nurse might suggest would be, here are the options. Option A, blowing air under the cast using a hairdryer on cool setting often relieves itching. Option B, slide a ruler under the cast and scratch the area. Option C, guide a towel under and through the cast and move it back and forth to relieve the itch. Option D, gently thump on cast to dislodge dried skin that causes the itching. The correct answer is option A. Blowing air under the cast using a hairdryer on cool setting often relieves itching. A cool air will often relieve pruritus without damaging the cast or irritating the skin. B. The nurse should never force anything under the cast because the cast may become damaged and skin breakdown may occur. C. Forcing an object under the cast could lead to cast damage and skin breakdown. The object may become lodged under the cast, necessitating cast removal. D. This technique does not dislodge skin cells. It could damage the cast and cause skin breakdown. Question 21. A 30-year-old client has just been treated in the ER for bruises and abrasions to her face and a broken arm from domestic violence, which has been increasing in frequency and intensity over the last few months. The nurse assesses her as being very anxious, fearful, bewildered, and feeling helpless as she states, "I don't know what to do, I'm afraid to go home." The best response by the nurse to the client would be, here are the options. Option A, I wouldn't want to go home either. Call a friend who could help you. Option B, did you do something that could have made him so angry? Option C, let's talk about people and resources available to you so that you don't have to go home. Option D, I'll call the police and they will take care of him, and you can go home and get some rest. The correct answer is option C. Let's talk about people and resources available to you so that you don't have to go home. A person in crisis needs support, assistance, and direction from a caregiver rather than just an instruction. B. A battered person may feel guilt and think that they caused the abuser's behavior. However, the abuser has the problem and goes through phases of violence. C. The nurse should provide support and guidance to the client in crisis by offering alternatives and assist and referrals. D. Focusing on help from law enforcement may be a very temporary solution, because the victim may be fearful of pressing charges. This answer does not address the crisis of going home. Question 22. A 26-year-old client is in a treatment center for prazolam Xanax abuse and continues to manifest moderate levels of anxiety 3 weeks into the rehabilitation program, often requesting medication for his nerves. Included in the client's plan of care is to identify alternate methods of coping with stress and anxiety other than use of medication. After intervening with assistance in stress reduction techniques, identifying feelings and past coping, the nurse evaluates the outcome as being met if. Here are the options. Option A. Client promises that he will not abuse prazolam after discharge. Option B. Client demonstrates use of exercise or physical activity to handle nervous energy following conflicts of everyday life. Option C. Client is able to verbalize effects of substance abuse on the body. Option D. Client has remained substance-free during hospitalization and is discharged. The correct answer is option B. Client demonstrates use of exercise or physical activity to handle nervous energy following conflicts of everyday life. This client response does not address stress reduction techniques. Verbal response focuses only on the problem. B. Exercise or physical activity is a common strategy or coping technique used to reduce stress and anxiety. C. Verbalizing effects of substance abuse on the body may help with insight and break through denial, but it is not a strategy to reduce anxiety. D. Remaining substance-free does indicate motivation to change lifestyle of substance abuse or dependence, and it is not a stress reduction strategy in itself. Question 23. A 23-year-old borderline client is admitted to an inpatient psychiatric unit following an impulsive act of self-mutilation. A few hours after admission, she requests special privileges, and when these are not granted, she stands up and angrily shouts that the people on the unit do not care, and she storms across the room. The nurse should respond to this behavior by. Here are the options. Option A. Placing her in seclusion until the behavior is under control. Option B. Walking up to the client and touching her on the arm to get her attention. Option C. Communicating a desire to assist the client to regain control, offering a one-to-one session in a quiet area. Option D. Confronting the client, letting her know the consequences for getting angry and disrupting the unit. The correct answer is option C. Communicating a desire to assist the client to regain control, offering a one-to-one session in a quiet area. Threatening a client with punitive action is violating a client's rights and could escalate the client's anger. B. Angry clients need respect for personal space, and physical contact may be perceived as a threatening gesture escalating anger. C. Client lacks sufficient self-control to limit own maladaptive behavior. She may need assistance from staff. D. Confronting an angry client may escalate her anger to further acting out, and consequences are for acting out anger aggressively, not for getting angry or feeling angry. Question 24. A 56-year-old client is admitted to the psychiatric unit in a state of total despair. She feels hopeless and worthless, has a flat affect and very sad appearance, and is unable to feel pleasure from anything. Her husband has been assisting her at home with the housework and cooking. However, she has not been eating much, lies around or sits in a chair most of the day, and is becoming confused and thinks her family does not want her around anymore. In assessing the client, the nurse determines that her behavior is consistent with. Here are the options. Option A. Transient depression. Option B. Mild depression. Option C. Moderate depression. Option D. Severe depression. The correct answer is option D. Severe depression. A transient depression manifests as sadness or the blues as seen with everyday disappointments and is not necessarily dysfunctional. B. Mild depression manifests as symptoms seen with grief response, such as denial, sadness, withdrawal, somatic symptoms, and frequent or continuous thoughts of the loss. C. Moderate depression manifests as feelings of sadness, negativism, low self-esteem, rumination about life's failures, decreased interest in grooming and eating, and possibly sleep disturbances. These symptoms are consistent with dysthymia. D. Severe depression manifests as feelings of total despair, hopelessness, emptiness, inability to feel pleasure, possibly extreme psychomotor retardation, inattention to hygiene, delusional thinking, confusion, self-blame, and suicidal thoughts. These symptoms are consistent with major depression. Question 25. A 56-year-old psychiatric inpatient has had recurring episodes of depression and chronic low self-esteem. She feels that her family does not want her around, experiences a sense of helplessness, and has a negative view of herself. To assist the client in focusing on her strengths and positive traits, a strategy used by the nurse would be to. Here are the options. Option A. Tell the client to attend all structured activities on the unit. Option B. Encourage or direct client to attend activities that offer simple methods to attain success. Option C. Increase the client's self-esteem by asking that she make all decisions regarding attendance in group activities. Option D. Not allow any dependent behaviors by the client because she must learn independence and will have to ask for any assistance from staff. The correct answer is option B. Encourage or direct client to attend activities that offer simple methods to attain success. The nurse should encourage activities gradually as clients' energy level and tolerance for shared activities improve. B. Activities that focus on strengths and accomplishments, with uncomplicated tasks, minimize failure and increase self-worth. C. Asking a client to set a goal to make all decisions about attending group activities is unrealistic, and such decisions are not always under the client's control. This sets up the client for further failure and possibly decreased self-worth. D. Encouragement toward independence does promote increased feelings of self-worth. However, clients may need assistance with decision-making and problem-solving for various situations and on an individual basis. Question 26. A 42-year-old client on an inpatient psychiatric unit comments that he was brought to the hospital by his wife because he had taken too many pills and states, "I just couldn't take it anymore." The nurse's best response to this disclosure would be, here are the options. Option A. You shouldn't do things like that. Just tell someone you feel bad. Option B. Tell me more about what you couldn't take anymore. Option C. I'm sure you probably didn't mean to kill yourself. Option D. How long have you been in the hospital? The correct answer is option B. Tell me more about what you couldn't take anymore. A disapproving gives the impression that the nurse has a right to pass judgment on the client's thoughts, actions, or ideas. B. Giving a broad opening gives the client encouragement to continue with verbalization. C. Failing to acknowledge the client's feelings conveys a lack of understanding and empathy. D. Changing the subject takes the conversation away from the client and is indicative of the nurse's anxiety or insensitivity. Question 27. A 42-year-old client with bipolar disorder has been hospitalized on the inpatient psychiatric unit. She is dancing around, talking incessantly, and singing. Much of the time the client is anorexic and eats very little from her tray before she is up and about again. The nurse's intervention would be to Here are the options. Option A. Confront the client with the fact that she will have to eat more from her trade to sustain her. Option B. Try to get the client to focus on her eating by offering a detailed discussion on the importance of nutrition. Option C. Let her have snacks and drinks anytime that she wants them because she will not eat at regular meal times. Option D. Not expect the client to sit down for complete meals. Monitor intake, offering snacks and juice frequently. The correct answer is option D. Not expect the client to sit down for complete meals. Monitor intake, offering snacks and juice frequently. The manic client's mood may easily change from euphoric to irritable. The nurse should avoid confrontation and let the client know what she can do rather than what she cannot. Although helpful to refocus or redirect the manic client to discuss only one topic at a time, distractibility is very high and it's best to avoid long discussions. Manic clients have a tendency to manipulate persons in their environment. Staff should monitor intake, including at mealtime and snacks, and be consistent in their approach to meeting nutritional needs. Manic clients may not sit and eat complete meals, but they can carry foods and liquids from regular meals with them. Staff can monitor and give high-caloric and high-energy snacks and liquids. Question 28. Assessment of severe depression in a client reveals feelings of hopelessness, worthlessness, inability to feel pleasure, sleep, psychomotor, and nutritional alterations, delusional thinking, negative view of self, and feelings of abandonment. These clinical features of the client's depression alert the nurse to prioritize problems and care by addressing which of the following problems first. Here are the options. Option A. Nutritional status. Option B. Impaired thinking. Option C. Possible harm to self. Option D. Rest and activity impairment. The correct answer is option C. Possible harm to self. Anorexia and weight loss are problems that need attention in severe depression, but they can be addressed secondary to immediate concerns. Impaired thinking and confusion are problems in severe depression that are addressed with administration of medication, through group and individual psychotherapy, and through activity therapy as motivation and interest increase. Possible harm to self as with suicidal ideation. A suicide plan means to execute plan, and / or overt gestures or an attempt must be addressed as an immediate concern and safety measures implemented appropriate to the risk of suicide. Rest and activity impairment may take time and further assessment to determine client's sleep pattern and amount of psychomotor retardation with the more immediate concern for safety present. Topic 3. Question set C. Question 29. The nurse is assessing and getting a history from a client treated for depression with a monoamine oxidase MAO antidepressant. The most serious side effect associated with this antidepressant and the ingestion of tyramine in aged foods may be. Here are the options. Option A. Hypertensive crisis. Option B. Severe rash. Option C. Severe hypotension. Option D. Severe diarrhea. The correct answer is option A. Hypertensive crisis. The most serious adverse reactions of MAO inhibitors involve blood pressure and ingestion of tyramine-containing foods, which may provoke a hypertensive crisis. MAO inhibitors cause adverse reactions affecting the central nervous system and serious adverse reactions involving blood pressure. MAO inhibits false neurotransmitters phenylalanines and may produce hypotensive reactions from gradual accumulation of these neurotransmitters. D. The most serious adverse reactions of MAO inhibitors involve blood pressure. Question 30. A cardinal symptom of the schizophrenic client is hallucinations. A nurse identifies this as a problem in the category of, here are the options. Option A. Impaired communication. Option B. Sensory perceptual alterations. Option C. Altered thought processes. Option D. Impaired social interaction. The correct answer is option B. Sensory perceptual alterations. Impaired communication refers to decreased ability or inability to use or understand language in an interaction. B. In sensory perceptual alterations, an individual has distorted, impaired, or exaggerated responses to incoming stimuli, i.e. a hallucination, which is a false sensory perception that is not associated with real external stimuli. C. An altered thought processes problem statement is used when an individual experiences a disruption in cognitive operations and activities, i.e. delusions, loose associations, ideas of reference. D. An impaired social interaction, the individual participates too little or too much in social interactions. Question 31. A schizophrenic client who is experiencing thoughts of having special powers states that I am a messenger from another planet and can rule the earth. The nurse assesses this behavior as, here are the options. Option A. Ideas of reference. Option B. Delusions of persecution. Option C. Thought broadcasting. Option D. Delusions of grandeur. The correct answer is option D. Delusions of grandeur. A client's experiencing ideas of reference believe that information from the environment, for example the television, is referring to them. B. Clients experiencing delusions of persecution believe that others in the environment are plotting against them. C. Clients experiencing thought broadcasting perceive that others can hear their thoughts. D. Clients experiencing delusions of grandeur think that they are omnipotent and have superhuman powers. Question 32. A client experiencing delusions states, I came here because there were people surrounding my house that wanted to take me away and use my body for science. The best response by the nurse would be, here are the options. Option A. Describe the people surrounding your house that want to take you away. Option B. I need more information on why you think others want to use your body for science. Option C. There were no people surrounding your house, your relatives brought you here, and no one really wants your body for science. Option D. I know that must be frightening for you. Let the staff know when you are having thoughts that trouble you. The correct answer is option D. I know that must be frightening for you. Let the staff know when you are having thoughts that trouble you. Focusing on the delusional content does not reinforce reality. B. Pursuing details or more information on the delusion reinforces the false belief and further distances the client from reality. C. Challenging the client's delusional system may force the client to defend it, and you cannot change the delusion through logic. D. Focusing on the feeling can reinforce reality and discourage the false belief. Seeking out staff when thoughts are troublesome can help to decrease anxiety. Question 33. A 16-year-old client with anorexia nervosa is on an inpatient psychiatric unit. She has a fear of gaining weight and is refusing to eat sufficient amounts to maintain body weight for her age, height, and stature. To assist with the problem of powerlessness and plan for the client to no longer need to withhold food to feel in control, the nurse uses the following strategy. Here are the options. Option A. Establish a structured environment with routine tasks and activities. Also serve meals at the same time each day. Option B. Distract the client during meals to get her to eat because she must take in sufficient amounts to keep from starving. Option C. Do frequent room checks to be sure that the client is not hiding food or throwing it away. Option D. Listen attentively and participate in in-depth discussions about food because these actions may encourage her to eat. The correct answer is option A. Establish a structured environment with routine tasks and activities. Also, serve meals at the same time each day. Anorexia nervosa clients feel out of control. Providing a structured environment offers safety and comfort and can help them to develop internal control, thus reducing their need to control by self-starvation. B. Distraction does not focus on the client's need for control. C. Doing frequent room checks reinforces feelings of powerlessness and the need to continue with the dysfunctional behavior. D. Participating in long discussions about food does not make the client want to eat, but rather this strategy allows her to indulge in her preoccupation and to continue with the dysfunctional behavior. Question 34. A 45-year-old male client was admitted to a chemical dependency treatment center following legal problems related to alcohol abuse. He states, "I know that alcohol is a problem for some people, but I can stop whenever I want to. I'm never sick or miss work, and no one can complain about me." During the initial assessment, the best response by the nurse would be, here are the options. Option A. The fact is you are an alcoholic or you wouldn't be here. Option B. I understand it took strength to admit yourself to the unit, and I will do my part to help you to stay alcohol-free. Option C. If you can stop drinking when you want to, why don't you stop? Option D. It's good that you can stop drinking when you want to. The correct answer is option B. I understand it took strength to admit yourself to the unit, and I will do my part to help you to stay alcohol-free. A direct confrontation initially is non-therapeutic and may result in the client becoming frustrated and wanting to leave. Be a positive, supportive attitude builds trust, and identifying positive strength raises self-esteem. Offering help allows the client to feel that he is not alone in dealing with problems. C. Asking the client why or to give an explanation for his behavior puts him in a position of having to justify his behavior to the nurse. D. Giving approval or placing a value on feelings or a behavior may limit the client's freedom to behave in a way that may displease another. This response may lead to seeking praise instead of progress. Question 35. A 79-year-old client with Alzheimer's disease is exhibiting significant memory impairment, cognitive impairment, extremely impaired judgment in social situations, and agitation when placed in a new situation or around unfamiliar people. The nurse should include the following strategy in the client's care. Here are the options. Option A. Maintain routines and usual structure and adhere to schedules. Option B. Encourage the client to attend all structured activities on the unit, whether she wants to or not. Option C. Ask the client to go to an activity once. If she gives no response right away, change the question around, asking the same thing. Option D. Give the client 2 or 3 choices to decide what she wants to do. The correct answer is option A. Maintain routines and usual structure and adhere to schedules. Alzheimer's clients cope poorly with changes in routine because of memory deficits. Schedule changes cause confusion and frustration, whereas adhering to schedules is helpful and supports orientation. B. Insisting that the client go to all unit activities may antagonize her and increase her agitation because of cognitive impairments. It may be better to allow the client time for calming down or distraction rather than to insist that she attend every activity. C. When repeating a question, allow time first for a response, then use the same words the second time to avoid further confusion. D. The nurse should avoid giving several choices at once. Cognitively impaired clients will become more frustrated with making decisions. Question 36. The nurse working with a client who is out of control should follow a model of intervention that includes which of the following? Here are the options. Option A. Approach the client on a continuum of least restrictive care. Option B. Challenge client's behavior immediately with steps to prevent injury to self or others. Option C. Leave the aggressive client to himself or herself and take other clients away. Option D. To ensure safety of other clients, place client in seclusion immediately when he or she begins shouting. The correct answer is option A. Approach the client on a continuum of least restrictive care. Approaching a client's aggressive behavior on a continuum of least restrictive care is in agreement with his or her rights, i.e., verbal methods to help maintain control, medication, seclusion, and restraints as necessary. B. Approaching a client in a challenging manner is threatening and inappropriate. A non-challenging and calm approach reflects staff and control and may increase client's internal control. C. It is inappropriate to leave an aggressive client who is acting out alone. The nurse should acquire qualified help to prevent client from harm or injury to self or others. D. Moving a client to seclusion immediately for shouting is inappropriate. The nurse should offer the client an opportunity to control self with limit setting. The client should understand that the staff will assist with control if necessary, i.e., quietly accompany out of environment to decrease stimulation and allow for verbalization employing the least restrictive care model of intervention. Question 37. When planning care for the passive-aggressive client, the nurse includes the following goal. Here are the options. Option A. Allow the client to use humor, because this may be the only way this client can express self. Option B. Allow the client to express anger by using messages such as "I was angry when," etc. Option C. Allow the client to have time away from therapeutic responsibilities. Option D. Allow the client to give excuses if he forgets to give staff information. The correct answer is option B. Allow the client to express anger by using messages such as "I was angry when," etc. Ceasing to use humor and sarcasm is a more appropriate goal, because this client uses these behaviors covertly to express aggression instead of being open with anger. B. Use of messages demonstrates proper use of assertive behavior to express anger instead of passive-aggressive behavior. C. Client is expected to complete share of work in therapeutic community because he has often obstructed others' efforts by failing to do his share. D. Client has used conveniently forgetting or withholding information as a passive-aggressive behavior, which is not acceptable. Question 38. A client calls the prenatal clinic to schedule an appointment. She states she has missed 3 menstrual periods and thinks she might be pregnant. During her first visit to the prenatal clinic, it is confirmed that she is pregnant. The registered nurse RN learns that her last menstrual period began on June 10. According to Negel's rule, the estimated date of confinement is. Here are the options. Option A. March 17. Option B. June 3. Option C. August 30. Option D. January 10. The correct answer is option A. March 17. Using Negel's rule, count back 3 calendar months from the first day of the last menstrual period. The answer is March 10. Then add 7 days and 1 year, which would be March 17 of the following year. B, C, D. This date is incorrect. Question 39. At 16 weeks gestation, a pregnant client is admitted to the maternity unit to have a McDonald procedure circlage done. She tells the RN who is admitting her to the unit that her physician had explained what this procedure was, but that she did not understand. The RN explains to the client that the purpose for this procedure is to. Here are the options. Option A. Reinforce an incompetent cervix. Option B. Repair the amniotic sac. Option C. Evaluate cephalopelvic disproportion. Option D. Dilate the cervix. The correct answer is option A. Reinforce an incompetent cervix. The treatment most commonly uses the sheared carburetor procedure, McDonald procedure, or circlage to enforce the weakened cervix by encircling it with a suture at the level of the internal os. B. There is no known procedure that is used to repair the amniotic sac. C. Cephalopelvic disproportion is evaluated later in pregnancy. It is not related to this procedure. D. No procedure is done to dilate the cervix at 16 weeks gestation unless the pregnancy is to be terminated. Question 40. A pregnant client continues to visit the clinic regularly during her pregnancy. During one of her visits while lying supine on the examining table, she tells the RN that she is becoming lightheaded. The RN notices that the client has pallor in her face and is perspiring profusely. The first intervention the RN should initiate is to. Here are the options. Option A. Place the examining table in the Trendelenburg position. Option B. Assess the client to see if she is having vaginal bleeding. Option C. Obtain the client's vital signs immediately. Option D. Help the client to a sitting position. The correct answer is option D. Help the client to a sitting position. This position would cause the gravid uterus to bear the increased pressure of the vena cava, which could lead to maternal hypotension, in turn causing the client to continue to have pallor and to feel lightheaded. B. This would not be the first intervention the RN should initiate. The RN should understand the supine position and its effect on the gravid uterus and vena cava. C. The RN's first intervention should be one that helps to alleviate the client's symptoms. Obtaining her vital signs will not alleviate her symptoms. D. This would move the gravid uterus off of the client's vena cava, which would alleviate the maternal hypotension that is the cause of her symptoms. Question 41. At 30 weeks gestation, a client is admitted to the unit in premature labor. Her contractions are every 5 minutes and last 60 seconds, her cervix is closed, and the suture placed around her cervix during her 16th week of gestation, when she had the McDonald procedure, can still be felt by the physician. The amniotic sac is still intact. She is very concerned about delivering prematurely. She asks the RN, "What is the greatest risk to my baby if it is born prematurely?" The RN's answer should be, here are the options. Option A. Hyperglycemia. Option B. Hypoglycemia. Option C. Lack of development of the intestines. Option D. Lack of development of the lungs. The correct answer is option D. Lack of development of the lungs. Any infant would be at risk for hyperglycemia because the infant's liver is missing the islets of Langerhans, which secrete insulin to break down glucose for cellular use. Prematurity is not an added risk for hyperglycemia. Both premature and mature infants can be at risk for hypoglycemia if their mother had gestational diabetes during pregnancy or entered the pregnancy with diabetes mellitus. These infants are exposed to high levels of maternal glucose while in utero, which causes the islets of Langerhans in the infant's liver to produce insulin. After birth, when the umbilical cord is severed, the generous amount of maternal blood glucose is eliminated. However, there is continued islet cell hyperactivity in the infant's liver, which can lead to excessive insulin levels and depleted blood glucose. See, mature infants are born with an immature GI system. The nervous control of the stomach is incomplete at birth, salivary glands are immature at birth, and the intestinal tract is sterile. This is not the greatest risk to the premature infant. Infants born before 37 weeks gestation are at greatest risk for an insufficient amount of surfactant in the alveoli system of the lungs. Surfactant helps to prevent lung collapse and ensures stability of the respiratory system, so that the infant can maintain his own respirations once the umbilical cord is severed at birth. Question 42. At 30 weeks gestation, a client is admitted to the unit in premature labor. Her physician orders that N Roman 4 be started with 500 ml D5W mixed with 150 mg of ritodrine-stat. The RN prepares the Roman 4 solution with the medication. The RN knows that clients receiving the medication ritodrine Roman 4 should be observed closely for which one of the following side effects. Here are the options. Option A. Hypoglycemia. Option B. Hyperkalemia. Option C. Tachycardia. Option D. Increase in hematocrit and hemoglobin. The correct answer is option C. Tachycardia. Ritodrine is a sympathomimetic adrenergic agonist that can cause an elevation of blood glucose and plasma insulin in pregnant women. Hyperglycemia can occur in women with abnormal carbohydrate metabolism because of their inability to release more insulin. Hypokalemia can occur resulting from the action of the mimetics. It results from a displacement of the extracellular potassium into the intracellular space. Ritodrine causes vasodilation of vessel walls, which can lead to hypotension. The body compensates by increasing heart rate and pulse pressure. There is a lowering of serum iron resulting from the action of mimetics to activate hematopoiesis. Question 43. At 32 weeks gestation, a client is scheduled for a fetal activity test non-stress test. She calls the clinic and asks the RN, "How do I prepare for the test I am scheduled for?" The RN will most likely inform her of the following instructions to help prepare her for the test. Here are the options. Option A. You need to know that N Roman 4 is always started before the test. Option B. You will need to drink 6 to 8 glasses of water to fill your bladder. Option C. Do not eat any food or drink any liquids before the test is started. Option D. You will have to remain as still as you possibly can. The correct answer is option D. You will have to remain as still as you possibly can. A N Roman 4 line is not started in a non-stress test because this test is used as an indicator of fetal well-being. This test measures fetal activity and heart rate acceleration. The bladder does not have to be full prior to this test. It is not a sonogram test where a full bladder enables other structures to be scanned. It has been proved that eating or drinking liquids prior to the test can assist in increasing fetal activity. Any maternal activity will interfere with the results of the test. Question 44. After the fetal activity test non-stress test is completed, the RN is looking at the test results on the monitor strip. The RN observes that the fetal heart accelerated 5 beats/min with each fetal movement. The accelerations lasted 15 seconds and occurred 3 times during the 20-minute test. The RN knows that these test results will be interpreted as, here are the options. Option A. A reactive test. Option B. A non-reactive test. Option C, an unsatisfactory test. Option D, a negative test. The correct answer is option A, a reactive test. A non-stress test that shows at least 2 accelerations of the fetal heart rate of 15 bpm with fetal activity, lasting 15 seconds over a 20-minute period. B. Reactive criteria are not met. The accelerations of the fetal heart rate are not at least 15 bpm and do not last 15 seconds. This could mean fetal well-being is compromised. Usually a contraction stress test is ordered if the non-stress test results are negative. C. An unsatisfactory test means the data cannot be interpreted or there was inadequate fetal activity. If this happens, usually the test is ordered to be done at a later date. D. A negative test is a term used to describe the results of a contraction stress test. Question 45. At 38 weeks gestation, a client is in active labor. She is using her Lamaze breathing techniques. The RN is coaching her breathing and encouraging her to relax and work with her contractions. Which one of the following complaints by the client will alert the RN that she is beginning to hyperventilate with her breathing? Here are the options. Option A, I am cold. Option B, I have a backache. Option C, I feel dizzy. Option D, I am nauseous. The correct answer is option C, I feel dizzy. A cold is not a symptom of hyperventilation. This could be due to the temperature of the room. B. Backache is not a symptom of hyperventilation. This is probably due to the gravid uterus and its effect on the back muscles, or it may be due to the client's position in bed. C. Dizziness is the first symptom of hyperventilation. It occurs because the body is eliminating too much CO2. D. Nausea is not a symptom of hyperventilation. It could be a symptom of pain. Question 46. After performing a sterile vaginal exam on a client who has just been admitted to the unit in active labor and placed on an electronic fetal monitor, the RN assesses that the fetal head is at 21 station. She documents this on the monitor strip. Fetal head at 21 station means that the fetal head is located where in the pelvis? Here are the options. Option A, 1 centimeter below the ischial spines. Option B, 1 centimeter above the ischial spines. Option C, has not entered the pelvic inlet yet. Option D, located in the pelvic outlet. The correct answer is option B, 1 centimeter above the ischial spines. The ischial spines are located on both sides of the midpelvis. These spines mark the diameter of the narrowest part of the pelvis that the fetus will encounter. They are not sharp protrusions that will harm the fetus. Station refers to the relationship between the ischial spines in the pelvis and the fetus. The ischial spines are designated at 0 station. If the presenting part of the fetus is located above the ischial spines, a negative number is assigned, noting the number of centimeters above the ischial spines. Therefore, 1 centimeter below the ischial spines is designated as +1 station. BC explanation in A. 1 centimeter above the ischial spines is designated as +1 station. C. The pelvic inlet is the first part of the pelvis that the fetus enters in routine delivery. The midpelvis is the second part of the pelvis to be entered by the fetus. The ischial spines are located on both sides of the midpelvis. D. The pelvic outlet is the last part of the pelvis that the fetus will enter. When the fetus reaches this part of the pelvis, birth is near. Question 47. A client has been admitted to the labor and delivery unit in active labor. After assessing her, the RN notes that the client's fetus position is left occipital posterior. Which of the following statements best describes what this means to the labor process? Here are the options. Option A. Decreases the overall time of the labor process. Option B. Prolongs the client's first stage of labor. Option C. Decreases the time of the client's first stage of labor. Option D. Prolongs the client's third stage of labor. The correct answer is option B. Prolongs the client's first stage of labor. A posterior position causes a larger diameter of the fetal head to enter the pelvis than an anterior position. Pressure on the sacral nerves is increased, and it takes the fetus a longer time to enter the pelvic inlet. B. This position will prolong the first stage of labor. When the larger diameter of the fetal head enters the pelvis first, it will have a more difficult time accommodating to the pelvis. Therefore, it will take a longer time for the fetus to move through the pelvis. C. It will increase the time of labor because the larger diameter of the fetal head will have a more difficult time accommodating to the pelvic inlet and thus will move through the pelvis slower. D. In the third stage of labor, the placenta is delivered. Therefore, the infant has been delivered. Question 48. A client is in active labor and has been admitted to the labor and delivery unit. The RN has just done a sterile vaginal exam and determines that the client is dilated 5 cm, effaced 85%, and the fetus's head is at 0 station. She asks if she could have a lumbar epidural now. The epidural is started, and the anesthetic agent used is bupivacaine marcaine. After the client has received her lumbar epidural, it is important for the RN to monitor her for which of the following side effects. Here are the options. Option A. Hypertension. Option B. Hypotension. Option C. Hypoglycemia. Option D. Hyperglycemia. The correct answer is option B. Hypotension. The medication bupivacaine will cause vasodilation in the vascular system, and this does not result in elevation of the maternal blood pressure. B. The medication bupivacaine will cause vasodilation in the vascular system, and this will result in lowering the maternal blood pressure. C. Bupivacaine does not interfere with the functioning of the endocrine system. D. Bupivacaine does not interfere with the functioning of the endocrine system. Question 49. A client has been in labor for 10 hours. Her contractions have become hypoactive and slowed in duration. The fetus is at 0 station. Cervix is dilated 8 cm and effaced 90%. The physician orders an oxytocin-pitocin infusion to be started at once. The RN begins the oxytocin infusion. It is important that the RN discontinue the infusion if which one of the following occur? Here are the options. Option A. The client's contractions are 2 minutes apart. Option B. Duration of the contractions are 60 seconds. Option C. The uterus relaxes between contractions. Option D. The client complains that she is tired. The correct answer is option A. The client's contractions are 2 minutes apart. It is very important that there is a resting phase or relaxation period between the contractions. During this period, the uterus, placenta, and umbilical vessels re-establish blood flow. No resting phase between contractions can lead to fetal bradycardia, fetal hypoxia, and acidosis. It can also result in a tetanic contraction, which can cause uterine rupture. B. The goal of the oxytocin infusion is to help establish a contraction pattern lasting 4,560 seconds occurring every 2 minutes and a uterine tonus of 6,070 mmHg. C. This choice is correct. The uterus has time to recover from the contraction. D. The client's tiring is no indication to stop the infusion. She will be tired even without the infusion. Question 50. The client has been in active labor for the last 12 hours. During the last 3 hours, labor has been augmented with oxytocin because of hypoactive uterine contractions. Her physician assesses her cervix is 95% effaced, 8 cm dilated, and the fetus is at 0 station. Her oral temperature is 100.2 F at this time. The physician orders that she be prepared for a cesarean delivery. In preparing the client for the cesarean delivery, which one of the following physician's orders should the RN question? Here are the options. Option A. Administer meperidine demerol 100 mg/IM 1 hour prior to the delivery. Option B. Discontinue the oxytocin infusion. Option C. Insert an indwelling Foley catheter prior to delivery. Option D. Prepare abdominal area from below the nipples to below the symphysis pubis area. The correct answer is option A. Administer meperidine demerol 100 mg/IM 1 hour prior to the delivery. Meperidine is a narcotic analgesic medication that crosses the placental barrier and reaches the fetus, causing respiratory depression in the fetus. A narcotic medication should never be included in the preoperative order for a cesarean delivery. B. Oxytocin infusion would be discontinued if client is being prepared for a cesarean delivery because the medication would not be needed. C. The bladder is always emptied prior to and during the surgical intervention to prevent the urinary bladder from accidentally being incised while the uterine incision is made. D. The abdominal area is always prepared to rid the area of hair before the abdominal incision is made. Abdominal hair cannot be sterilized and could become a source for postoperative incisional infection. Question 51. After an infant is delivered by cesarean delivery and placed on the warmer, the RN dries and assesses the infant. At 1 and 5 minutes after birth, the RN does the UPGAR scoring of the infant. The RN knows that because this infant was delivered by cesarean section, he is at increased risk for having which one of the following? Here are the options. Option A. Cold stress. Option B. Cyanosis. Option C. Respiratory distress syndrome. Option D. Seizures. The correct answer is option C. Respiratory distress syndrome. The infant is placed on the warmer and dried after birth. Cold stress occurs when the infant is not dried and kept warm. B. The fact that this infant was born by cesarean delivery does not place him at a greater risk for cyanosis than an infant delivered vaginally. Cyanosis occurs when infants cannot oxygenate their blood after the umbilical cord is severed. C. Infants born by cesarean delivery are at a higher risk for developing respiratory distress syndrome because these infants do not pass through the pelvis, where the chest is compressed and fluid is able to escape from the lungs. D. Cesarean delivered infants are not at greater risk for seizures than infants delivered vaginally. Question 52. After the RN is finished the initial assessment of a newborn baby and after the initial bonding between the newborn and the mother has taken place in the delivery room, the RN will bring the newborn to the well baby nursery. Before the newborn is taken from the delivery room and brought to the well baby nursery, the RN makes sure that which of the following interventions was completed. Here are the options. Option A. The physician verifies the exact time of birth. Option B. The nurse counts the instruments and sponges with the scrub nurse. Option C. The nurse instills prophylactic ointment in the conjunctival sacs of the newborn's eyes. Option D. The nurse makes sure the mother and her newborn have been tagged with identical bands. The correct answer is option D. The nurse makes sure the mother and her newborn have been tagged with identical bands. The delivery room personnel are responsible for verifying time of birth. B. The scrub and circulating nurses count sponges and instruments. C. This intervention is done in the nursery. D. Tagging the mother and infant with identical bands is of utmost importance. The mother wears 1 band, and the newborn wears 2. Identical numbers on the 3 bands provide identification for the newborn and the birth mother. Every time the newborn is brought to the mother after delivery, those bands are checked to be sure that the numbers are identical. Question 53. On a mother's second postpartum day after having a vaginal delivery, the RN is preparing to assess her perineum and anus as part of her daily assessment. The best position for the client to be placed in for this assessment is, here are the options. Option A, Sims. Option B, Fowlers. Option C, Prone. Option D, any position that the RN chooses. The correct answer is option A, Sims. The Sims position is the best position for assessment of the perineum and anus. The top leg is placed over the bottom leg, and the RN raises the upper buttocks to fully expose the perineum and anus. B. Fowler's position is a sitting position, and the perineum and anus would not be exposed. C. The prone position would have the mother on her back, and her perineum and anus would not be exposed. D. The position of choice should always be the Sims. Question 54. While the RN is assessing a mother's perineum on her second postpartum day after having a vaginal delivery, the RN notes a large ecchymotic area located to the left of the mother's perineum. Which one of the following interventions should the RN initiate at this time? Here are the options. Option A, have the client expose the area to air. Option B, apply ice to the perineum. Option C, encourage the client to take warm sitz baths. Option D, inform the physician. The correct answer is option C, encourage the client to take warm sitz baths. The area is bruised and painful. This action would do nothing to help with the healing process of the perineum or to provide comfort. Ice is effective immediately after birth to reduce edema and discomfort, but not on the second postpartum day. Sitz baths are useful if the perineum has been traumatized, because the moist heat increases circulation to the area to promote healing, relaxes tissue, and decreases edema. D. The physician is not notified of bruising, but if a hematoma is present, then the physician is notified. Question 55. A mother who is breastfeeding her newborn asks the RN, "How can I express milk from my breasts manually?" The RN tells her that the correct method for manual milk expression includes using the thumb and the index finger too. Here are the options. Option A, alternately compress and release each nipple. Option B, roll the nipple and gently pull the nipple forward. Option C, slide the thumb and index finger forward from the outer border of the areola toward the end of the nipple. Option D, compress and release each breast at the outer border of the areola. The correct answer is option D. Compress and release each breast at the outer border of the areola. A manipulation of nipples will cause soreness and trauma. B. Pulling the nipples will cause discomfort and soreness. C. Sliding the thumb and index finger forward over the nipple will cause soreness. D. The best method to express milk from the breast is to position the thumb and index finger at the outer border of the areola and compress. This is the location of the milk sinuses. Question 56. A client had a vaginal delivery 3 days ago and is discharged from the hospital on the second day postpartum. She told the RN, "I need to start exercising so that I can get back into shape. Could you suggest an exercise I could begin with?" The RN could suggest which one of the following. Here are the options. Option A, push-ups. Option B, jumping jacks. Option C, leg lifts. Option D, Kegel exercises. The correct answer is option D, Kegel exercises. A, B, C. This exercise is too strenuous at this time. D. This exercise is recommended for the first few days after delivery. It helps to stimulate muscle tonus in the area of the perineum and the area around the urinary meatus and vagina. Question 57. A 60-year-old male client was hospitalized 3 days ago with the diagnosis of acute anterior wall myocardial infarction. Today he has been complaining of increasing weakness and shortness of breath. Crackles in both lung bases are audible on auscultation. He is developing. Here are the options. Option A, an extension of his myocardial infarction. Option B, pneumonia. Option C, pulmonary edema. Option D, pulmonary emboli. The correct answer is option C, pulmonary edema. Extensions of his myocardial infarction would be chest pain unrelieved with nitroglycerin, cardiac enzyme elevations, and electrocardiographic changes. B. Persons with pneumonia may complain of weakness and shortness of breath and have crackles in their lung bases. However, they would also have sputum production and leukocytosis. C. Persons who have had myocardial infarctions, especially anterior wall, are at risk of developing left ventricular heart failure, which is a major cause of pulmonary edema. Pulmonary edema is manifest by shortness of breath, weakness, and crackles on auscultation of the lung fields. D. Pulmonary emboli may be accompanied by shortness of breath, weakness, and crackles. However, the pulmonary hypertension that accompanies pulmonary emboli results in signs of increased systemic venous pressure as well. Question 58. On admission, the client has signs and symptoms of pulmonary edema. The nurse places the client in the most appropriate position for a client in pulmonary edema, which is, here are the options. Option A, high Fowler. Option B, lying on the left side. Option C, sitting in a chair. Option D, supine with feet elevated. The correct answer is option A, high Fowler. A high Fowler position decreases venous return to the heart and permits greater lung expansion, so that oxygenation is maximized. B. Lying on the left side may improve perfusion to the left lung, but does not promote lung expansion. C. Sitting in a chair will decrease venous return and promote maximal lung expansion. However, clients with pulmonary edema can deteriorate quickly and require intubation and mechanical ventilation. If a client is sitting in a chair when this deterioration happens, it will be difficult to intervene quickly. D. The supine with feet elevated position increases venous return and will worsen pulmonary edema. Question 59. A male client has been hospitalized with congestive heart failure. Medical management of heart failure focuses on improving myocardial contractility. This can be achieved by administering. Here are the options. Option A, digoxin Lanaxin 0.25 mg/po every day. Option B, furosemide Lasix 40 mg/po every morning. Option C, O22L/min via nasal cannula. Option D, nitroglycerin nitrile 1 inch topically every 4 hours. The correct answer is option A. Digoxin-Lennoxin 0.25 mg/po every day. A digoxin is a cardiac glycoside given to clients in heart failure to improve their myocardial contractility. B. Furosemide is a loop diuretic given to clients in heart failure to promote diuresis. CO2 is given to clients in heart failure to increase oxygenation and to prevent or treat hypoxemia. D-nitroglycerin is a nitrate given to clients in heart failure to increase their cardiac output by decreasing the peripheral resistance that the left ventricle must pump against. Question 60. A client's congestive heart failure has been treated, and he will soon be discharged. Discharge teaching should include instruction to call the physician if he notices a 2 lb weight gain in a 24-hour period. Increased weight gain may indicate, here are the options. Option A. A diet too high in calories and saturated fat. Option B. Decreasing cardiac output. Option C. Decreasing renal function. Option D. Development of diabetes insipidus. The correct answer is option B. Decreasing cardiac output. Increased calories may result in weight gain, but there is no indication in this question that this man's diet has changed in a way that would result in increased calories. B. Decreasing cardiac output stimulates the renin-angiotensin-aldosterone cycle and results in fluid retention, which is reflected by weight gain. C. Decreasing renal function may result in fluid retention, but this question gives no indication that this man has any renal problems. D. Profound diuresis occurs with diabetes insipidus, which results in weight loss. Question 61. A client was not using his seat belt when involved in a car accident. He fractured ribs 5, 6, and 7 on the left and developed a left pneumothorax. Assessment findings include, here are the options. Option A. Crackles and paradoxical chest wall movement. Option B. Decreased breath sounds on the left and chest pain with movement. Option C. Rhonchi and frothy sputum. Option D. Wheezing and dry cough. The correct answer is option B. Decreased breath sounds on the left and chest pain with movement. Crackles are caused by air moving through moisture in the small airways and occur with pulmonary edema. Paradoxical chest wall movement occurs with flail chest when a segment of the thorax moves outward on inspiration and inward on expiration. B. Decreased breath sounds occur when a lung is collapsed or partially collapsed. Chest pain with movement occurs with rib fractures. C. Rhonchi are caused by air moving through large fluid-filled airways. Frothy sputum may occur with pulmonary edema. D. Wheezing is caused by fluid in large airways already narrowed by mucus or bronchospasm. Dry cough could indicate a cardiac problem. Question 62. A client has a chest tube placed in his left pleural space to re-expand his collapsed lung. In a closed chest drainage system, the purpose of the water seal is to, here are the options. Option A. Prevent air from entering the pleural space. Option B. Prevent fluid from entering the pleural space. Option C. Provide a means to measure chest drainage. Option D. Provide an indicator of respiratory effort. The correct answer is option A. Prevent air from entering the pleural space. A chest tube extends from the pleural space to a collection device. The tube is placed below the surface of the saline so that air cannot enter the pleural space. B. Fluid may enter the pleural space as a result of injury or disease. A chest tube may drain fluid from the pleural space, but the water seal is not involved in this. C. Chest drainage should be measured, but the water seal is not involved in this. D. Fluctuations in the tube in the water-sealed bottle will give an indication of respiratory effort, but that is not the purpose of the water seal. Question 63. A client was admitted with rib fractures and a pneumothorax, which were sustained as a result of a motor vehicle accident. A chest tube was placed on the left side to reinflate his lung, and he was transferred to a client unit. 24 hours after admission, he continues to have bloody sputum, develops increasing hypoxemia, and his chest X-ray shows patchy infiltrates. The nurse analyzes these symptoms as being consistent with. Here are the options. Option A, pneumonia. Option B, pulmonary contusions. Option C, pulmonary edema. Option D, tension pneumothorax. The correct answer is option B, pulmonary contusions. A pneumonia may be reflected by patchy infiltrates. In addition, fever, an increasing white blood cell count, and copious sputum production would be present. B. Blunt chest trauma causes a bruising process in which interstitial and alveolar edema and hemorrhage occur. This is manifest by gradual deterioration over 24 hours of arterial blood gases and the continued production of bloody sputum. Patchy infiltrates are evident on chest X-ray 24 hours post-injury. C. Pulmonary edema usually results from left heart failure. It is manifest by pink, frothy sputum, increasing dyspnea, tachycardia, and crackles on auscultation. Detention pneumothorax is a potential complication for someone with rib fractures and a chest tube. It is manifest by diminished breath sounds on the affected side, rapidly deteriorating arterial blood gases in the presence of an open airway, and shock that is unexplained by other injuries. Question 64. A 66-year-old female client has smoked 2 packs of cigarettes per day for 20 years. Her arterial blood gases on room air are as follows: pH 7.35, PO2 70 mmHg, PCO2 55 mmHg, HCO 332 mx/L. These blood gases reflect. Here are the options. Option A, compensated metabolic acidosis. Option B, compensated respiratory acidosis. Option C, compensated respiratory alkalosis. Option D, uncompensated respiratory acidosis. The correct answer is option B, compensated respiratory acidosis. In compensated metabolic acidosis, the pH level is normal, the PCO2 level is decreased, and the HCO3 level is decreased. The client's primary alteration is an inability to remove excess acid via the kidneys. The lungs compensate by hyperventilating and decreasing PCO2. In compensated respiratory acidosis, the pH level is normal, the PCO2 level is elevated, and the HCO3 level is elevated. The client's primary alteration is an inability to remove CO2 from the lungs, so over time, the kidneys increase reabsorption of HCO3 to buffer the CO2. In compensated respiratory alkalosis, the pH level is normal, the PCO2 level is decreased, and the HCO3 level is decreased. The client's primary alteration is hyperventilation, which decreases PCO2. The client compensates by increasing the excretion of HCO3 from the body. In uncompensated respiratory acidosis, the pH level is decreased, the PCO2 level is increased, and the HCO3 level is normal. The client's primary alteration is an inability to remove CO2 from the lungs. The kidneys have not compensated by increasing HCO3 reabsorption. Question 65. A female client with chronic obstructive pulmonary disease (COPD) has presented in the emergency department with cough productive of yellow sputum and increasing shortness of breath. On room air, her blood gases are as follows: pH 7.30 mmHg, PCO2 60 mmHg, PO2 55 mmHg, HCO3 32 mx/L. These arterial blood gases reflect. Here are the options. Option A: compensated respiratory acidosis. Option B: normal blood gases. Option C: uncompensated metabolic acidosis. Option D: uncompensated respiratory acidosis. The correct answer is option D: uncompensated respiratory acidosis. In compensated respiratory acidosis, the pH level is normal, the PCO2 level is elevated, and the HCO3 level is elevated. The client's primary alteration is an inability to remove CO2 from the lungs, so over time, the kidneys increase reabsorption of HCO3 to buffer the CO2. B. Normal ranges for arterial blood gases for adults and children are as follows: pH 7.35 7.45, PO2 31 mmHg, PCO23 345 mmHg, HCO32 31 28 mx/L. C. In uncompensated metabolic acidosis, the pH level is decreased, the PCO2 level is normal, and the HCO3 level is decreased. The client's primary alteration is an inability to remove excess acid via the kidneys. The lungs are unable to clear the increased acid. D. In uncompensated respiratory acidosis, the pH level is decreased, the PCO2 level is increased, and the HCO3 level is normal. In a person with long-standing COPD, the HCO3 level will rise gradually over time to compensate for the gradually increasing PCO2, and the person's pH level will be normal. When a person with COPD becomes acutely ill, the kidneys do not have time to increase the reabsorption of HCO3, so the person's pH level will reflect acidosis even though the HCO3 is elevated. Question 66. A 9-year-old client has sustained a C7 fracture, which resulted in his spinal cord being partially transected. By 2 weeks post-injury, his neck has been surgically stabilized and he has been transferred from the intensive care unit. A potential life-threatening complication the nurse monitors the client for is. Here are the options. Option A: autonomic dysreflexia. Option B: bradycardia. Option C: central cord syndrome. Option D: spinal shock. The correct answer is option A: autonomic dysreflexia. Autonomic dysreflexia is the exaggerated sympathetic nervous system response to various stimuli in the anesthetized area. Sympathetic stimulation results in severe uncontrolled hypertension, which may result in myocardial infarction or cerebral hemorrhage. B. Bradycardia occurs as a result of sympathetic blockade in the immediate post-injury period. After spinal shock recedes, cardiovascular stability returns, but the client will be bradycardiac for life. C. Central cord syndrome is a specific type of spinal cord injury that occurs as a result of either hyperextension injuries or disrupted blood flow to the spinal cord. D. Spinal shock occurs in the immediate post-injury phase and usually resolves in approximately 72 hours. Question 67. A 17-year-old client has a T4 spinal cord injury. At present, he is learning to catheterize himself. When he says, "This is too much trouble. I would rather just have a Foley," an appropriate response for the RN teaching him would be. Here are the options. Option A: I know. It is a lot to learn. In the long run, though, you will be able to reduce infections if you do an intermittent catheterization program. Option B. It is not too much trouble. This is the best way to manage urination. Option C. Okay, I'll ask your physician if we can replace the Foley. Option D. You need to learn this because your doctor ordered it. The correct answer is option A. I know. It is a lot to learn. In the long run, though, you will be able to reduce infections if you do an intermittent catheterization program. This response acknowledges the client's feelings, gives him factual information, and acknowledges that the final decision is his. B. This response is judgmental and discourages the client from expressing his feelings about the procedure. C. Catheterization is a procedure that takes time to learn, but which, for the spinal cord injured client, can significantly reduce the incidence of urinary tract infections. A young client with a T4 injury has the hand function to learn this procedure fairly easily. D. The final decision about bladder elimination management ultimately rests with the client and not the physician. Question 68. A client's physician has prescribed theophylline Theodure to help control the bronchospasm associated with the client's COPD. Instructions that should be given to the client include, here are the options. Option A. Call your physician if you develop palpitations, dizziness, or restlessness. Option B. Cigarette smoking may significantly increase the risk for theophylline toxicity. Option C. Take this medication on an empty stomach. Option D. Do not take your medicine if your pulse is less than 60 beats per minute. The correct answer is option A. Call your physician if you develop palpitations, dizziness, or restlessness. Indications of theophylline toxicity include palpitations, dizziness, restlessness, nausea, vomiting, shakiness, and anorexia. B. Cigarette smoking significantly lowers theophylline plasma levels. C. Theophylline should be taken with food to decrease stomach upset. D. These instructions are appropriate for someone taking digoxin. Question 69. A 9-year-old client fell off a ladder approximately 3 ft to the ground. He did not lose consciousness, but was taken to the emergency department by a friend to have a scalp laceration sutured. The nurse instructs the client to. Here are the options. Option A. Clean the sutured laceration twice a day with povidone iodine betadine. Option B. Remove his scalp sutures after 5 days. Option C. Return to the hospital immediately if he develops confusion, nausea, or vomiting. Option D. Take meperidine 50 mg po Q46 HPRN for headache. The correct answer is option C. Return to the hospital immediately if he develops confusion, nausea, or vomiting. Povidone iodine is very irritating to skin and should not be routinely used. B. Sutures should not be removed by the client. C. Confusion, nausea, vomiting, and behavioral changes may indicate increasing intracranial pressure as a result of intracerebral bleeding. D. Use of a narcotic opiate such as meperidine is not recommended in clients with a possible head injury because it may produce sedation, pupil changes, euphoria, and respiratory depression, which may mask the signs of increasing intracranial pressure. Question 70. A male client has asthma and his physician has prescribed beclomethasone Vanserol 3 puffs TID in addition to his other medications. After taking his beclomethasone, the client should be instructed to. Here are the options. Option A. Clean his inhaler with warm water and soak it in a 10% bleach solution. Option B. Drink a glass of water. Option C. Sit and rest. Option D. Use his bronchodilator inhaler. The correct answer is option B. Drink a glass of water. An inhaler should be cleaned once a day. They should be taken apart, washed in warm water, and dried according to manufacturer's instructions. Soaking in bleach is inappropriate. A common side effect of inhaled steroid preparations is oral candidal infection. This can be prevented by drinking a glass of water or gargling after using a steroid inhaler. See, there is nothing wrong with sitting and resting after using a steroid inhaler, but it is not necessary. If a person is using a steroid inhaler as well as a bronchodilator inhaler, the bronchodilator should always be used first. The reason for this is that the bronchodilator opens up the person's airways so that when the steroid inhaler is used next, there will be better distribution of medication. Question 71. A 70-year-old client has pneumonia and has just had a respiratory arrest. He has just been intubated with an 8 mm endotracheal tube. During auscultation of his chest, breath sounds were found to be absent on the left side. The nurse identifies the most likely cause of this as, here are the options. Option A. Inappropriate endotracheal tube size. Option B. Left-sided pneumothorax. Option C. Right mainstem bronchus intubation. Option D. Pneumonia. The correct answer is option C. Right mainstem bronchus intubation. Appropriate endotracheal tube sizes for adults range from 7.0 to 8.5 mm. Pneumothorax could be indicated by an absence of breath sounds on the affected side. However, in a recently intubated client, the first priority would be to consider tube malposition. During intubation, the right mainstem bronchus can be inadvertently entered if the endotracheal tube is inserted too far. Left mainstem bronchus intubation almost never occurs because of the angle of the left mainstem bronchus. Deep breath sounds for someone with pneumonia may be decreased over the areas of consolidation. However, in a recently intubated client, the first priority would be to consider tube malposition. Question 72. A 55-year-old client is unconscious and his physician has decided to begin tube feeding him using a small-bore silicone feeding tube KioFeed dual tube. After the tube is inserted, the nurse identifies the most reliable way to confirm appropriate placement is to. Here are the options. Option A. Aspirate gastric contents. Option B. Auscultate air insufflated through the tube. Option C. Obtain a chest X-ray. Option D. Place the tip of the tube underwater and observe for air bubbles. The correct answer is option C. Obtain a chest X-ray. Aspiration of gastric contents is usually a reliable way to verify tube placement. However, if the client has dark respiratory secretions from bleeding, tube feedings could be mistaken for respiratory secretions. In other words, aspirating an empty stomach is less reliable in this instance. In addition, it is common for small-bore feeding tubes to collapse when suction pressure is applied. Insufflation of air into large-bore nasogastric tubes can usually be clearly heard. In small-bore tubes, it is more difficult to hear air, and it is difficult to distinguish between air in the stomach and air in the esophagus. A chest X-ray is the most reliable means to determine placement of small-bore nasogastric tubes. Observing for air bubbles when the tip is held under water is an unreliable means to determine correct tube placement for all types of nasogastric tubes. Air may come from both the respiratory tract and the stomach, and the client who is breathing shallowly may not force air out of the tube into the water. Question 73. A 70-year-old client is almost finished receiving her second unit of packed red blood cells. The client, who weighs 80 lb, has started complaining of being short of breath and now has crackles in the bases of her lungs. After slowing or stopping the transfusion, the most appropriate initial nursing action would be to. Here are the options. Option A. Raise the client's head and place her feet in a dependent position. Option B. Notify the physician. Option C. Place the client on 2 liters of O2 via nasal cannula. Option D. Administer furosemide Lasix 20 mg Roman 4 push. The correct answer is option A. Raise the client's head and place her feet in a dependent position. Raising the client's head and placing her feet in a dependent position is an independent nursing action that can be taken to decrease venous return and to reduce pulmonary congestion. B. Notifying the physician is an appropriate action that should be taken after the client is positioned to maximize her respiratory status. C. Placing the client on O2 may be done with a physician's order or according to an institution's standing orders. However, other actions should be taken first. D. Furosemide 20 mg Roman 4 push is an appropriate medication for the client, but it must be ordered by her physician. Question 74. A 52-year-old client's abdominal aortic aneurysm ruptured. She received rapid massive blood transfusions for bleeding. One potential complication of blood administration for which she is especially at risk is, here are the options. Option A. Air embolus. Option B. Circulatory overload. Option C. Hypocalcemia. Option D. Hypokalemia. The correct answer is option C. Hypocalcemia. Air embolism is a potential complication of blood administration, but it is fairly rare and can be prevented by using good Roman 4 technique. B. Circulatory overload is a potential complication of blood administration, but because this client is actively bleeding, she is not at high risk for overload. C. Hypocalcemia is a potential complication of blood administration that occurs in situations where massive transfusion has occurred over a short period of time. It occurs because the citrate in stored blood binds with the client's calcium. Another potential complication for which this client is especially at risk is hypothermia, which can be prevented by using a blood warmer to administer the blood. D. Hypokalemia is not a complication of blood administration. Question 75. A 67-year-old client will be undergoing a coronary arteriography in the morning. Client teaching about post-procedure nursing care should include that. Here are the options. Option A. Bed rest with bathroom privileges will be ordered. Option B. He will be kept NPO for 812 hours. Option C. Some oozing of blood at the arterial puncture site is normal. Option D. The leg used for arterial puncture should be kept straight for 812 hours. The correct answer is option D. The leg used for arterial puncture should be kept straight for 812 hours. A bed rest will be ordered for 812 hours post-procedure. Flexing of the leg at the arterial puncture site will occur if the client gets out of bed, and this is contraindicated after arteriography. B. The client will be able to eat as soon as he is alert enough to swallow safely, and that will depend on what medications are used for sedation during the procedure. C. Using at the arterial puncture site is not normal and should be closely evaluated. D. The leg where the arterial puncture occurred must be kept straight for 812 hours to minimize the risk of bleeding. Question 76. A client had a myocardial infarction 5 days ago. His physician has ordered an echocardiogram to determine how his myocardial infarction has affected his ventricular wall motion. When the client asks if this test is painful, an appropriate response is, here are the options. Option A. No, but you must be able to ride on a stationary bicycle while the test is being performed. Option B. No, but you will have to lie still and the gel that is used may be cool. Option C. Yes, but your physician will be there and will order pain medicine for you. Option D. Your physician has ordered medicine, which you will be given before you go for the test, which will make you sleepy. The correct answer is option B. No, but you will have to lie still and the gel that is used may be cool. Riding a stationary bicycle or walking on a treadmill is done during a stress test. B. During an echocardiogram, the client must lie supine while a technician performs the test. To perform the test, the technician uses a conductive gel and a transducer to obtain ultrasound tracings of the heart. C. A physician need not be present during an echocardiogram, and it is neither invasive nor painful. D. There is no premedication required for an echocardiogram. Question 77. A 55-year-old man has recently been diagnosed with hypertension. His physician orders a low-sodium diet for him. When he asks, what does salt have to do with high blood pressure? The nurse's initial response would be, here are the options. Option A. The reason is not known why hypertension is associated with a high-salt diet. Option B. Large amounts of salt in your diet can cause you to retain fluid, which increases your blood pressure. Option C. Salt affects your blood vessels and causes your blood pressure to be high. Option D. Salt is needed to maintain blood pressure, but too much causes hypertension. The correct answer is option B. Large amounts of salt in your diet can cause you to retain fluid, which increases your blood pressure. This response is untrue. B. Decreasing salt intake reduces fluid retention and decreases blood pressure. C. Salt does not have an effect on the blood vessels themselves, but on fluid retention, which accompanies salt intake. D. This response is untrue. Question 78. A client has consented to have a central venous catheter placed. The best position in which to place the client is the Trendelenburg position. The reason is that the Trendelenburg position, here are the options. Option A. Allows the physician to visualize the subclavian vein. Option B. Reduces the possibility of air embolism. Option C. Reduces the possibility of hematoma formation. Option D. Makes the procedure more comfortable for the client. The correct answer is option B. Reduces the possibility of air embolism. The subclavian vein is not visible during central line insertion regardless of the client's position. B. The Trendelenburg position reduces the possibility of air embolism because it places slight positive pressure on the central veins. It also distends the veins, and distension facilitates insertion. C. This response is untrue. It has no effect on hematoma formation. D. This position is not necessarily more comfortable for the client, and many clients, especially those who may be short of breath, may find the position uncomfortable and difficult to maintain. Question 79. A newborn infant is exhibiting signs of respiratory distress. Which of the following would the nurse recognize as the earliest clinical sign of respiratory distress? Here are the options. Option A. Cyanosis. Option B. Increased respirations. Option C. Sternal and subcostal retractions. Option D. Decreased respirations. The correct answer is option C, sternal and subcostal retractions. A cyanosis is a late clinical sign of respiratory distress. B. Rapid respirations are normal in a newborn. C. The newborn has to exert an extra effort for ventilation, which is accomplished by using the accessory muscles of ventilation. The diaphragm and abdominal muscles are immature and weak in the newborn. D. Decreased respirations are a late clinical sign. In the newborn, decreased respirations precede respiratory failure. Question 80. A nurse is performing a vaginal exam on a client in active labor. An important landmark to assess during labor and delivery are the ischial spines because here are the options. Option A. Ischial spines are the narrowest diameter of the pelvis. Option B. Ischial spines are the widest diameter of the pelvis. Option C. They represent the inlet of birth canal. Option D. They measure pelvic floor. The correct answer is option A. Ischial spines are the narrowest diameter of the pelvis. The fetal descent or station is determined by the relationship of the presenting part to the spine. B. Ischial spines are the narrowest measurement. C. Ischial spines measure the pelvic outlet. D. Pelvic floor measurement is not related to fetal descent. Question 81. The nurse instructs a client on the difference between true labor and false labor. The nurse explains, in true labor, here are the options. Option A. Uterine contractions will weaken with walking. Option B. Uterine contractions will strengthen with walking. Option C. The cervix does not dilate. Option D. The fetus does not descend. The correct answer is option B. Uterine contractions will strengthen with walking. Uterine contractions increase with activity. Walking will increase the strength and regularity of uterine contractions in true labor. C. Uterine contractions that are strong and regular facilitates cervical dilation. D. Regular, strong uterine contractions, as in true labor, result in fetal descent. Question 82. A first trimester primavera is diagnosed with anemia. The nurse should suspect that this anemia is a result of, here are the options. Option A. Mother's increased blood volume. Option B. Mother's decreased blood volume. Option C. Fetal blood volume increase. Option D. Increase in iron absorption. The correct answer is option A. Mother's increased blood volume. A maternal blood volume increases at the end of the first trimester, leading to a dilutional anemia. B. Maternal blood volume increases. C. Fetal blood volume is minimal in the first trimester. D. Increased iron absorption would facilitate the manufacturing of erythrocytes and decrease anemia. Question 83. In client teaching, the nurse should emphasize that fetal damage occurs more frequently with ingestion of drugs during. Here are the options. Option A. First trimester. Option B. Second trimester. Option C. Third trimester. Option D. Every trimester. The correct answer is option A. First trimester. Organogenesis occurs in the first trimester. Fetus is most susceptible to malformation during this period. B. Organogenesis has occurred by the second trimester. C. Fetal development is complete by this time. D. The dangerous period for fetal damage is the first trimester, not the entire pregnancy. Question 84. A laboring client presents with a prolapsed cord. The nurse should immediately place the client in what position? Here are the options. Option A, reverse Trendelenburg. Option B, Fowler's. Option C, Trendelenburg. Option D, Sims. The correct answer is option C, Trendelenburg. A reverse Trendelenburg position increases pressure on the perineum. This position will not relieve cord pressure. B. Fowler's position increases perineal pressure. Cord pressure would not be relieved. C. Trendelenburg position will decrease perineal pressure. Cord compression will be decreased and increase in fetal blood flow occurs. D. Sims position does not relieve pressure on cord or perineum. Question 85. A client suspects that she is pregnant. She reports 2 missed menstrual periods. The first day of her last menstrual period was August 3. Her estimated date of confinement would be, here are the options. Option A, November 7. Option B, November 10. Option C, May 7. Option D, May 10. The correct answer is option D, May 10. A wrong calculation. B. Wrong calculation. C. Wrong calculation. D. Negel's rule is expected date of confinement equals last menstrual period 3 months plus 7 days plus 1 year. Question 86. An elective saline abortion has been performed on a 3-week prima gravida. Following the procedure, the nurse should be alert for which early side effect? Here are the options. Option A, water satiety. Option B, thirst. Option C, edema. Option D, diabetes insipidus. The correct answer is option B, thirst. If the client is experiencing water satiety, there is no more desire for water. B. Absorption of saline into circulation rather than into amniotic sac increases serum sodium and desire for water. C. Edema can be a late side effect caused by water intoxication. D. Diabetes insipidus occurs as a result of deficient antidiuretic hormone.